Welcome back to our Halal Medical. Today we talk about lymphocytosis. Have you ever received complete blood picture test results and noticed a number that was higher than usual? Specifically, the word lymphocytes, followed by an arrow pointing up or higher level than normal. What does it actually mean? High lymphocyte count is called lymphocytosis. Are high lymphocyte counts always a cause for worry? In this video, we'll explore what lymphocytes are, what their primary function is, and most importantly, what an elevated count can to tell you about your health. By the end of this video, you'll have a clear understanding of your blood picture. To understand why a high count matters, we first need to understand what lymphocytes are. Think of them as the special forces of your immune system. While all white blood cells are part of your body's defense, lymphocytes are the highly specialized for targeted attacks and long-term memory. They are of two main types, B cells and T cells. B cells are like the intelligence unit. They produce antibodies that neutralize foreign invaders like bacteria and viruses. T cells, on the other hand, are the direct fighters. There are different types of T cells, but their main job is to find and destroy infected cells and even cancer cells. So when your body detects a threat, your bone marrow starts producing more of these highly specialized cells to fight it off. This increase is what we see as an elevated lymphocyte count on a blood test. Now let's get to the main question. What could be causing your high lymphocyte count? The most common reason by far is an infection. Viral infections. This is the big one. Viruses are sneaky and often hide inside your cells, which is a job for T cells to handle. A high lymphocyte count is a classic sign that your body is doing a strong defense against a virus. Common culprits include the flu, infectious mononucleosis, also known as glandular fever, and even some respiratory viruses. A high count in this case is a sign that your immune system is working exactly as it should be. Bacterial infection. While bacterial infections often trigger an increase in another type of white blood cell, a high lymphocyte count can also be a sign of a persistent or chronic bacterial infection, like whooping cough or tuberculosis. Chronic condition. Sometimes a high lymphocyte count can be a sign of an ongoing low-grade inflammatory or autoimmune condition where your immune system is constantly in a state of alert. Conditions like Crohn's disease or rheumatoid arthritis can sometimes show lymphocytosis. Stress and recovery. Even something as simple as recovering from surgery or a period of intense physical or emotional stress can temporarily cause your lymphocyte count to rise as your body works to repair and restore itself. While most cases of elevated lymphocytes are benign and temporary, it's important to understand the less common but more serious causes. Lymphoproliferative disorders. In rare cases, a persistently high lymphocyte count could be a sign of a condition where the bone marrow produces more of lymphocytes. This could include conditions like chronic lymphocytic leukemia, or CLL. It's important to know that this is a rare cause, and a single high count on its own is not a diagnosis. Your doctor will look for other symptoms like unexplained weight loss, night sweats, or enlarged lymph nodes. A follow-up test and possibly other investigations will be required to get a complete picture. Lymphoma. In some cases, a high lymphocyte count can be associated with certain types of lymphoma, which is a cancer of the lymphatic system. Again, this is not a common cause, but it highlights the importance of not dismissing a consistently elevated result without seeking medical help. So, you have your blood test results in hand, and the lymphocytes are high. What's your next step? Don't panic. Remember, a single blood test result is just a snapshot in time. High lymphocyte counts are most often a normal response to an infection. Talk to your doctor. This is the most important step. Your doctor will interpret your results in the context of your overall health, symptoms, and medical history. They may also suggest additional tests if they have any concerns. In conclusion, an elevated lymphocyte count is usually a positive sign that your immune system is hard at work fighting off an infection. It's a testament to the incredible defense system we all have within us. But like any sign from your body, it deserves attention and should always be discussed with a healthcare professional. If you like the video, like and share it. Don't forget to subscribe.
Oh.